In this lead up to America's 250th birthday, KCTV5 is committed to highlighting ways our local communities have shaped American history. In this week's We the People, celebrating 250 years, we spotlight Medicaid and Medicare.
It was signed 60 years ago today, right here in the Metro. KCTV5's Ryan Hennessy spotlights the history made and the jeopardy the programs face today.
Medicaid and Medicare are woven into the fabric of nearly every hospital operating today, including here at University Health, where nearly half of all their patients are enrolled in Medicaid.
Both programs were pretty far-sighted in what they were trying to accomplish, and clearly they've been very, very successful.
That success spans 6 decades. Medicaid and Medicare were signed into law by President Lyndon B. Johnson right here in Independence, a nod to another president who dreamed of universal health care. Expanded health care was a long dream of Harry S. Truman's. This is where history meets the present. 6 years ago, LBJ signed the law with Truman right on his left side, watching him do it, bringing health care access to more individuals in the United States. You can see Bess, Harry's wife, in the white, standing behind him.
Pretty unusual for a president to go somewhere else to sign legislation outside of the White House. You know, they usually take all the credit for themselves, but he really gave a lot of credit to Harry Truman that day.
But that wasn't the only way LBJ put Truman in the spotlight that day.
They asked me to bring along your new Medicare card.
That's right. Harry and Bess were handed the first 2 Medicare cards, a tribute to Truman's effort to pass the program 2 decades earlier.
We haven't forgotten who is the real daddy of Medicare.
Back then, a third of Americans over 65 were living in poverty.
This is the desk on which Lyndon Johnson signed Medicare and Medicaid into law on this day in 1965.
Fast forward to today, Medicaid and Medicare are changing under a new bill signed earlier this month by President Trump.
Well, I think both Harry Truman and Lyndon Johnson would be deeply concerned about the state of Medicare and Medicaid today.
Under the new rules, recipients must reapply for Medicaid every 6 months, and for many, there's now a work requirement of at least 80 hours a month.
You know, we got a little bit of time, so those 2 big provisions don't go in until the end of 26 and the beginning of 27.
Here at University Health, they're actually thinking ahead, considering a new smartphone app to help patients navigate the changes, because as these programs have adapted and evolved over the last 60 years, so have hospitals that rely on them. In Kansas City, Ryan Hennessy, KCTV5.